The reason we did this study to begin with is we know about 10% of patients that have major abdominal surgery end up in rehab afterwards. And we wanted to see if the COVID pandemic had any type of impact on that number or why it may have an impact on that. So we looked at about 116 patients, about 116,000 patients, about 90,000 of whom had surgery in 2017 through 2019, and 26,000 patients had surgery in 2020. We only looked at quarters 2, 3, 4, because the restrictions for COVID didn't really hit towards mid or end March in most places. And we used multiple years, and that's what was added to the data to adjust for inter-year variability that may have occurred. And we found that discharge pre-pandemic was 10%, which agreed with previous literature. But once the pandemic hit, the discharge to rehab rate dropped to about 7%. So we saw a 3% drop, even though we were doing more emergent operations, as our data shows, and more open operations, which you typically think of as people requiring rehab more.
This project really stemmed from just what we saw during the pandemic, which was, just anecdotally, patients' families had fears about them going to these rehab facilities, which were, very good, but everything was uncertain at that time. So we wondered if that had an impact on a bigger scale other than just at our institution, which is why we arranged this study. But then we wanted to know, well, what's the downside? Was there a downside to it? Are patients getting readmitted more frequently as a result of going back to their home or whatever institution they were at prior to being admitted versus going to a new place with a higher level of nursing care? And we didn't find that they were readmitted more often.